Hi, this is a presentation I gave back at the PAEA Annual Education Forum in 2011 on basic item analysis. Not much has changed, so I thought we'd go ahead and record this and use it. The objectives of the next hour or so will be to define terms as they apply to exam and item analysis, and describe how each of these metrics is obtained from either Scantron or your LMS software, or by calculating it in a spreadsheet, and then describe how each of these metrics is analyzed and compared during the item analysis. I don't have any disclaimers, and we talk first about writing a test. So the first part of testing is to figure out what you're going to test and to write the test. And as we've seen, there's a lot of different variables there. How many questions are you going to have? What content are you going to cover and not cover? What kind of questions are you going to have? Is it going to be computer-based? Is it going to be Scantron? Is it just going to be a written exam that you manually grade and analyze? How much time are you going to give for it? What content are you going to cover? Are you going to give it open book, closed book, whatever? Now, a couple of things we already know about multiple choice questions, but it behooves us to review. What you want to do if you're putting questions into an LMS for item analysis is you want to be uniform in the way that you do it. So typically you want to give a title to each question, and then each question, of course, has a stem, which is better known as the question. And then you've got distractors, which are the incorrect answers, and you've got the correct answer. I typically, when I write questions, I put the title as a unique name. The stem, of course, follows the writing guidelines set out by the NBME. And then I mark the correct answer with an asterisk. I usually use 5 answer multiple choice questions, so there's 4 incorrect answers and 1 correct answer. Once you get the test created, then you give the test and you grade the test, and now you get to the item analysis, the test analysis and the item analysis. So I like to print this out because I make lots of notes on the analyses that I do. This is a typical report from Scantron. We'll get into each of these details in just a minute. And this is the way that the report comes out from an LMS called Blackboard. Each LMS is different. You just will have to learn how to use the specific LMS that you've got at the program you end up teaching at. Here's the question by question analysis, how the group did on each question. You can see the question title and then the number of people that took it, and how the whole group did, the upper quartile and the lower quartile, and then what the discrimination factor was. So the first thing I like to look at is the exam mean. So the exam mean in this case is, you can see that there's possible 25 points and 18.5 was the mean. Some LMSs will actually divide that for you, and they'll show that this exam had a mean of 93.14, which you might think is kind of high, but that's another thing that you've decided when you wrote your test is, are you looking for a normal score distribution, or are you expecting people to be more competent at this, and so the scores to be skewed more towards the 90s. So you can't necessarily make anything of this 93 right now because we don't know what this test was designed to do, but that means that the test was either too easy, or the students knew the test was a good test and the students did well because they knew what was expected. Now, I want to really look at the question difficulties and the question analysis. That's what the purpose of this recording is primarily. So what I do is I go through, and here you've got, once again, you've got the question title, you've got the number of people that took it, the percentage that answered it correctly, the whole group, the upper quartile, the lower quartile, and the discrimination. The difficulty for each question is denoted by the small letter P. Okay, so you can see the difficulty of 307 AN1 was 98.57. You can see down at the bottom, 103 AN2 was 78.57. Right? So that's the difficulty. Now, how do you know if something's too difficult? Well, statistically, it's been calculated that in terms of, if you only have a true-false question, then you have a 50-50 chance of guessing. So if you've got a three distractor or three-choice question, then you've got a 33% chance of guessing. So what you'll see statistically, it's been calculated that with two alternatives, the difficulty, if the difficulty is less than 75%, then you want to look at it and you want to see if it's too difficult. With three alternatives, you look at 67%, four alternatives, 63%, and five alternatives, 60%. So since most of my tests are five alternatives, I keep 60% in my head, and that's what I'm primarily looking for. So here's our final exam that I gave for a pharmacology course. And let's take a look at the difficulties. So we're looking at the 4th column where it says whole group. And we're looking for, these are, take my word, these are 5 alternative multiple choice questions. So I highlight everything that has a whole group difficulty less than 60%. So you can see that item number 2 is 53. Number 3 is 46. Number 6 is 53. So a lot of 53s, a lot of 46s. Okay. So I mark those. The next thing that you need to have to do item analysis, first you need to know the difficulty for each question, and then you've also got to have you're going to want to take a look at those questions and see what their response frequencies were, or the response distribution. So when you look at a question to see how it did, one of the main things you're going to want to see is what were the incorrect answers that students chose. So here's the Scantron form again. It shows 5 columns called response frequencies for each question. So you can see on that first question, question number 1, the correct answer was C. 80% of the students chose C, 20% chose A. So if you go over and you see that the correct group responses, the total was 80%, then you know that the 20% who got it wrong all chose the same answer. And that's interesting, not random, so you may want to look at that answer and make sure that that answer isn't tricky or also correct. If you use Blackboard as your learning management system, as well as some of the other newer ones, you may find that they don't give you the response distribution, and it requires you to do just a little bit of extra work. If you download the records, it will give you a spreadsheet that shows by student what they answered. So the student is the row, and the columns are each question. So here you can see that the first column shows down towards the bottom, you see the title is Farm 00.004.003-4. That's the question title, and a simple spreadsheet formula, the count if formula, you can use to count how many people chose A, B, C, D, or E. Then I like to, because most people, if you're doing this for your faculty, most people don't want to see all these spreadsheets and have stuff here and have stuff there. So I usually tried, when I was the director of assessment, for each exam, I would do all this in the background, and then I would give a spreadsheet. I would print out a spreadsheet as a PDF that showed everything we needed. So this shows the test name, Farm 1 final exam, and then it shows each question, and it shows the highlighted ones are the ones that I marked as possibly too difficult. And then I'll show you where the response distribution is in just a second. The second thing we need to look at, though, before we go on, is we're not only looking at the difficulty, you also want to look at the discrimination. So the discrimination calculation tells you how well you would expect that a question that everybody didn't get right, you would expect that the students who do more poorly on the exam would be more likely to be the ones who got that question wrong than students who did better on the exam. So for each question, you expect that the poorer scoring students on that exam are more likely to have gotten the questions wrong than the better performing students. And that's what the discrimination index calculates for you. So there's another column over here that shows the discrimination index. Now, how do you interpret that? Well, just like the difficulty, which we're using less than 60% getting it correct, is an indicator that we might need to look at it. That is based in statistics, but you'll find a lot of programs don't go by that. They have their own ideas and their own statisticians and their own understandings of statistics. So that's kind of program specific. The discrimination index can also be program specific, depending on who's doing the assessment analysis and how much they've read, and like everything in the world, it's controversial. One thing that's not controversial is a negative discriminator. So a negative discriminator is problematic because it means that the students who overall did well on the test were more likely to miss this question than students who did less well on the test. And that doesn't make sense. Typically that means there's something wrong with the question. It's either miskeyed or has two answers potentially. So 40 to 100 is a well-accepted range for an excellent item in terms of discrimination. 25 to 39 is good. Less than 24 or less than 25 is usually unacceptable, but sometimes it'll be approved. I've been at talks. I've talked to people who are involved in item analysis. Sometimes this is a very cut and dry. If it's less than 25, we are not going to accept it. We're going to throw it out or do something. Other times, well, it depends. And I'm kind of the it depends school. I'll show you some later and explain why that might happen. Main thing to remember here is we're going to look for difficulty less than 60, and we're going to look for discriminators that are less than 25. Okay. So here's some of the questions. Once I've marked each question and highlighted it as needing to be looked at, then we look at each one individually. So here's the question title, the question stem. We've got A through E, so five choices. B is clearly marked as the answer. P, remember, is the difficulty. So the difficulty of this question was 54%. So almost half the class missed it. The discriminator is 44, which is pretty good. A lot of people I know who do item analysis, they would look at that and they'd say, okay, great, let's move on. We're not gonna tear this question apart. It's got good numbers. It's a difficult question, but it discriminated well. The students who knew their stuff were more likely to get it right than the students who didn't do as well on the exam. It is nice to look at the response distribution, not as necessary in this particular question, but it's nice to have it because you might want to use this to rewrite the question in the future. So you can see that 38 of the students chose the right answer. Of the students who didn't choose the right answer, those kind of accumulated around A and C with much fewer choosing D and E. So let's look at this. Which of the following is not a feature of P glycoproteins in the intestine? Act as extruding transporters, remove substances from enterocytes. Well, that's not what they do. They enhance the absorption of drugs from the GI lumen. So the A and C are actually the opposite, and that has me confused already. See, I'm already explaining it wrong because this is a not question, right? So P glycoproteins, they are extruding transporters. These are the things that are in the enterocytes, which when substances are absorbed, the P glycoproteins kick them back out. So A is correct, which means it's not a correct answer because this is a negative stem, which we're not supposed to use. They do remove substances. They do remove substances from enterocytes, so C is not a correct answer because it is true. You're looking for things that are false. This is very confusing, isn't it? And it gets even more confusing once you try to convince yourself, like I just did, of why the question's right and not wrong and doesn't need to be changed and all that. And you start to see why we don't use negative stems, right? So in this case, this is a good example where you could just keep it and you could say, well, the students who got this right obviously know their stuff, obviously have a good enough grasp of English and critical thinking and the ability to hold information in their head to remember that this is a negative question. On the other hand, I just confused myself just trying to explain it to you. So imagine a student who doesn't have as good a grasp of English, who maybe English is their second language. Are you really trying to test their grasp of English and their ability to think with negatives and all? No, you're not. You're trying to test their ability of P glycoproteins. So I could imagine in some cases you might actually want to omit this question. That's called validity. And let's talk real quick about validity. There's a bunch of different statistical terms for validity. To make it really simple when you look at exams, I like to think of internal and external validity. Internal validity I think of as, did we teach it? Well, I taught this course. I know that I taught them what P glycoproteins are, so I know that, and I know that I stressed that they were going to have to know what P glycoproteins were for the test. So internally, I would say this is a valid question. It was taught. Externally, though, external validity to me is, does it matter? Well, in one hand, I could argue, because I was the pharmacology teacher, that I think that P glycoprotein and cytochrome P450s are really very important concepts in today's medicine because of the number of pharmaceuticals that we prescribe and the number of drug-drug interactions and drug side effects that we see. So externally, I would argue this is valid. But as we just talked through, as you talk through what it might actually be testing, it's not necessarily testing the student's knowledge of P glycoproteins. There may be a significant portion of your students that are getting tricked up because it's actually testing their ability to think beyond with these negative stems and double negatives, et cetera, et cetera. So external validity would be a place where I might ding this question and say, yeah, we might want to rethink this. So perhaps I keep it on this exam, and in the future, when I relook at this question, I might look at it and say, okay, I need to rechange this from a negative question to a positive single answer question. Let's look at another one. So what single factor affects drug binding to receptors the most? The difficulty is 47%, so over half the class got it wrong. And the discriminator is 28, which is good. It's not excellent, but it's good. Now, in this case, let's take a look then at the response pattern. So you can see that the answer is drug concentration affects drug binding to receptors the most. But most of the people who got it wrong put drug solubility. That's interesting. So difficulty is okay, it's difficult. Discriminator is okay, it's good. The response distribution is kind of interesting in that you have to say, why did so many people put drug solubility? And this might, having taught this, obviously A is the answer, but I could also see a yeah, but in that I really stress drug solubility. Is the drug water soluble or lipid soluble? And I'm not thinking so much, when I talk about that, I'm not talking so much about receptors on cell surfaces in the intestines for absorption. I, as the teacher, am talking more about the lipid solubility and how it affects the protein binding in the serum, or the lipid solubility and how it affects the capillary membranes. So something, I can see why they might say drug solubility. It's not exactly true, but it's another case where looking strictly at the numbers, you could say, okay, it's a difficult question, but it has a good enough discriminator. But by actually looking at the answers, is it that important? So validity, did I teach it? Internal validity, yes. External validity is it really that important? Can you as a experienced clinician say, okay, I would have known the answer to this because it's very important. I think about this. I understand this every time I prescribe drugs, which I do every day. And if you're not able to say that, then you need to be able to say, as an instructor, a professor now, you need to be able to say, so this is the first week of pharmacology in the PA pharmacology course. So should first-year PA students, their first week of pharmacology, should they be held to knowing this information? So once again, by the numbers, I might accept this, but I could also argue, well, maybe not. Maybe we should take two answers. Okay. Here's another one. Let's go through this. A patient presents with abdominal pain and burning epigastric discomfort. An endoscopy has benign ulcers in the antral mucosa. Which of the following meds will provide the fastest, albeit probably the briefest, relief of the discomfort with just a single dose? Now, this one's interesting. You can see that the P is 54%, right? So about half and half. The R is 39, which is the upper limit of good, almost excellent. So just by those numbers, I'm not too concerned. But look at the response distribution. So obviously magnesium hydroxide is just an oral antacid. That's going to give you, and it was, in terms of internal validity, that was stressed in the course that your oral antacids are going to give you the fastest but briefest relief of the discomfort. Interesting that they chose misoprostol. Misoprostol, as you recall, is a medication that you can give. It's an abortifacient if you give it topically on the cervix, or it dilates the cervix, but it is also a medicine that was given. I don't know how common it is these days, but remember this test was written back in 2011. It used to be given to prevent GI ulceration in people on chronic NSAID use. So I'm not sure why so many students chose that. It's kind of interesting. I might want to go back to my lectures, my PowerPoints, my cases, and see what was it that we taught about misoprostol. Was there perhaps, maybe I had some quizzes. I used to do a lot of repetitive quizzes, and maybe I had some repetitive quizzes that were miskeyed, that had similar questions where misoprostol was the answer, and the students using the testing effect had learned from that. So I'm not sure. Once again, with a P of 54% and an R of 39, I would be tempted to either just take A, because that is definitely the right answer, or maybe look into it a little bit and see why did so many people put C, and if there's any question that I might have actually taught that wrong or taught it in a way that could be misinterpreted, then maybe take A and C. Here's another one. 42-year-old female presents with left ankle pain, which she describes as 3 out of 10. After a thorough physical exam and x-rays, you diagnose a mild ankle sprain. Her history includes GERD, for which she takes omeprazole, in addition to heat, ice, crutches, elevation, and physical therapy. Which of the following meds is the most appropriate management for this patient? So this is back when we would teach that for mild pain, you didn't go to opiates, and you had your choice of Tylenol, APAP, or NSAIDs. In this case, NSAIDs wouldn't be the correct answer because she already has GERD and she takes omeprazole every day. We see that the difficulty is 59%, so just barely made the cut. The R, though, the discriminator is negative, so a negative 5.56. That means that of the people who missed it, you were more likely to have done well overall on the rest of the test than to have done poorly. Interesting. So let's look at the distribution and see if we can figure out what that is. So nobody wanted to give a strong opioid agonist. Nobody threw Dilaudid at the mild ankle sprain. That's good. Nobody wanted to give a mixed opioid agonist-antagonist. The majority wanted to give Tylenol, APAP, which is what I was hoping they would do. But, and 18 wanted to give an NSAID. So that's obviously wrong. And 11, though, wanted to give a weak opioid agonist. Well, okay, I can kind of see that. These are, keep in mind with validity, I gave them a chart. We went through cases where we chose, just like this question, we chose which analgesic agent to use based on the severity of the pain and the comorbid conditions. So they shouldn't be choosing weak opioid agonist. They certainly shouldn't be choosing NSAID, because we also, even in terms of internal validity, it was taught. External validity is, does it matter? Well, yes, in clinical practice it matters. And we also have to ask, okay, so students in their first year of PA school, should they know this? And I would argue, yes, this is a concept. You don't give NSAIDs to people with GERD who are taking omeprazole every day. So the 18 who chose E, I think are just out of luck. I'm certainly not going to say, yeah, okay, I can see how you might have done that. The 11 who chose a weak opioid agonist, perhaps, remember, we also stress in pharmacology the importance of not undertreating pain. So it might be that students who actually went and read the 2000 Institute of Health study that talked about the 100,000 people being killed every year by medical errors, that was also taught in this course. It might be, and the subsequent changes, let's say, by JCO, which made pain one of the fifth vital signs, then it might be that some of the better performing students actually got kind of caught up in, okay, well, Tylenol might be right, but this might be a case where he's trying to get us to use that weak opioid agonist. I'm not sure. I can't read their minds. I'm just showing you how you can look at these questions and it's not all about the numbers. Validity is very important. What did you teach, and is it important in the overall scheme of things? So in this case, you certainly, and I think we probably did, we said, hey, the difficulty was 59. The R was negative, though. We're definitely not going to take E as an NSAID, but I think I probably ended up regrading this, taking B or D as possible answers. Let's do just one or two more, okay? Here's a good one. Which of the following classes of antidepressants slow cardiac conduction and are the most cardiotoxic? The difficulty is 47%. And the discriminator was 33. So it's a fairly good item. It's a difficult item, but it's fairly good. You can see that the majority of the students, well, I wouldn't say the majority because the difficulty is 47%, but 33 students chose the right answer, which is tricyclics, and the majority of the students who got it wrong chose MAO inhibitors. It's probably important to, if you remember what's going on here, remember that tricyclics, the main problem with tricyclics is their cardiotoxicity. So that was definitely, in terms of internal validity, I can guarantee that was covered a lot in the lectures about behavioral health medications and how careful you have to be, and how there was far less successful suicide among depressed patients once we got SSRIs and SNRIs, because you would give them tricyclics, and if they overdosed with their tricyclics, the cardiotoxicity made them very likely to be successful in their suicide attempts. So I know that I went through that really well. On the other hand, we hadn't had cardiology yet. So students who didn't have the clinical experience that I had as a paramedic, who knew it from a paramedic, as well as a PA with an interest in cardiology, okay, I can see why they got the word that SSRIs and SNRIs are much less cardiotoxic than older antidepressants. They just had difficulty, 33 of them had difficulty choosing between MAO inhibitors and tricyclics. So once again, this is one that by the numbers you probably could justify saying, okay, take tricyclics and let's move on. But I think you could also, if you really are interested in analyzing how your exam is doing in testing what you hope it's testing, I think you could look at it. You could maybe make a case for MAO inhibitors also, just because of the number of students who obviously, just didn't get that. So here's some more. The last thing I like to do is, once I have explained and decided all of the highlighted ones, the highlighted questions are the ones that had the difficulty less than 60% if they had 5 distractors. I like to go back and look at the discriminators for the other questions, because sometimes you'll get, if you had a question that had a difficulty of 61%, but had a negative discriminator, you might want to look at that also, because that, once again, the discriminator tells you that even though 61% got it correct, of the 39% that got it incorrect, more of those 39 did better on the test overall than the ones who got it incorrect. So in this case, I would circle the minus 5.56 for the question on the first question on row number 3. I usually don't go back and look at them though if the whole group, if the difficulty is 90 or above, because what happens is that if 2 people missed that question, 2 or 3 people out of 71 missed that question, and 2 of the 3 did well on the test, then it's going to give you a negative discriminator. So I'm not going to go back and spend a whole lot of time on a question that only 10% of the class missed. I might look at it again next year when I to see if there's something I need to fix on it. Once again, zeros, those I might look at a little more carefully, because a 0 means that the same number of people in the lower quartile for the exam missed it as in the highest quartile, the first quartile for the exam. And with the difficulty being a little lower, 84% and 63%, that's another one I want to go back and look at the response distribution to see what's going on there. It's very seldom that I would throw out or take 2 answers on a question that has a 90% difficulty, which means that 90% got it right. But occasionally I've seen that. Okay. This is just some additional questions. I won't go through these in detail, but let me go ahead and put them on the video here. You can pause and take a look at it if you want to. These are the ones that didn't qualify by difficulty, but did qualify by discrimination. And here's the last one. Okay, so now what do you do? One thing I really want to stress, and I want you to think about, and if this isn't real obvious to you, come to office hours and ask me about it, or post it in the discussion, because it's a really important concept that I've had a lot of trouble with other faculty not understanding. So now it's time to regrade your exam. You've made all of these decisions. You've decided either to throw out the question, or to take more than one answer, or to just keep it the way it is. I would argue that very seldom do you want to completely throw out a question. If you remember, let's say that you have a test that has 100 questions. Every question is worth 1 point. If you find something that's just a really crummy question, and let's go backwards and see if I can find one. We talked about this. This one wasn't really crummy. Let's talk about this one. Okay, perfect example. And with a negative discriminator, a lot of times these are the ones that you're tempted just to throw out. It must be horrible. Well, think about the math. if this is on a 100-question test and every question is worth 1 point, if you throw it out completely, if you say, well, yeah, I can see why they would put Tylenol, that's the correct answer, but I can also see why they might put weak opioid agonist, and it's not really fair to take weak opioid agonist because actually more put NSAID, so let's just throw it out. Well, now every question that remains is worth more than 1%. Because now you've only got 99 questions. So the 42 people who got it correct get penalized. Does that make sense? If I got it correct, then I got my 1 point. If I got it correct and you threw it out, that makes every question, every other question that I missed, worth more than 1 point. So I'm getting penalized. I got the question correct, but I'm getting penalized on my test score if you throw out the question. Does that make sense? So typically, you don't want to throw out a question. If anybody got it correct, you're penalizing them by throwing it out. Instead, what you'd want to do is you'd want to rescore it. This one I would take B or D perhaps. I would run it back through. There's still 100 questions on the test. The people who put E are still going to get this one wrong, but the people who put B, now they're going to be scored correct. Let's take another example. This is a good one. So here's our magnesium hydroxide question. If we decided, well, I could see how we might just want to throw the whole thing out because 4 people got cimetidine, 27 misoprostol, 2 omeprazole. It's just a bad question. Let's just throw it out. Well, what's going to happen is that the 38 who got it right, now every question they got incorrect in the rest of the exam is going to penalize them more than it did if you just took A and C, let's say, or even A, B, C, and D. Occasionally you take all 4 answers. By taking all 4 answers, you still have a denominator of 100. There's still 100 questions in the exam, so each one's worth 1 point. If you throw it out, now the denominator is 99, so every question is worth a little bit more. If that doesn't make sense, please, please, please come talk to me. Okay? And let me know if you have other questions. The main thing I wanted to see from here is I wanted you to see that although there's a lot of numbers involved, it's really just a 4-step process. You want to look at the difficulty of the question. You want to look at the discrimination index. You want to look at the response distribution. And then you want to think about internal and external validity. All right. Thank you.